Good morning, everyone, and welcome to Glasgow and to Scotland. For some of you, this may be your first time here. The sun always shines here in Scotland. Don't let anyone tell you otherwise. I hope while you're here, you may get an opportunity to sample some of our great food and hospitality, and perhaps even do a little bit of shopping in our great city of Glasgow. But today, though, is the first day of what is a hugely important event. And I have to say that I really am so pleased and grateful that so many of you have travelled from around the world to be here. We are very honoured to be the first country to host this summer. We're quite keen to host world events, and last year, some of you may have joined us for the Commonwealth Games, where we welcomed the world. In fact, this venue that you're sitting in today was one of the venues for the Commonwealth Games last year. But today, we are very pleased to be welcoming you to discuss such an important issue as viral hepatitis. And it's very appropriate that we've been asked to host this first World Hepatitis Summit because over the last 10 years, we have worked very hard with our partners to tackle viral hepatitis, and we've learned a lot in that time. I want to be able to share a little bit of that with you today, but this week you have an opportunity to share lessons from across the world. You'll hear a lot of examples of good practice and how countries are tackling this hugely important issue. I want to tell you a little bit today about our journey. In Scotland, we are lucky that we do not have a significant burden of disease associated with hepatitis B, but we're not complacent about this. But hepatitis B has not been a public health concern for us. Hepatitis C, however, has been an issue of significant public concern for quite some time. Initially, this related to the transmission of hepatitis C via blood and blood products in the period up to 1991. And we're still dealing with this tragedy. And I know that some people who were affected by hepatitis C in this way will be with us in the audience today, and we remain absolutely committed to providing better support to those affected by that tragedy. But about 10 years ago, there started to be a broader discussion about the epidemiology of hepatitis C in Scotland, driven in large part by patient groups and public health experts. And this led to political interest and a recognition that we were facing an epidemic, and that in turn ultimately culminated in the development of our Hepatitis C Action Plan. The first phase of the plan was published in 2006. A second phase, supported by significant investment, started in 2008. I was Minister for Public Health during the period we developed the second phase of the action plan, and I remember very clearly the very good discussions that we had with clinicians, with public health experts and patients at the time. I remember our ambition to make a meaningful difference to the epidemiology of hepatitis C in Scotland, and I recall our drive to get more people diagnosed and into care and to ensure good prevention strategies were in place. Our aspiration was to see change on an industrial scale. Our goal was significant improvements in public and individual health. The Scottish Government committed significant investment over 3 years, and we expected to see meaningful progress being made. And looking back now, we have made real improvements, and we've made a meaningful difference to people's lives, which is hugely important. Prevention was a key priority. We knew that the vast majority of new infections of hepatitis C in Scotland were through injecting drug use. As a result, we invested considerably in services which provide injecting equipment, and we developed robust guidelines for these services. And we secured the support of Scotland's Criminal Justice Prosecution Service for the principle of provision of injecting equipment to drug users. Our intention was that, as far as possible, every injecting episode would use clean equipment. This policy, as you can imagine, was not without its critics, and within Scotland there was quite considerable debate about the government funding injecting equipment for drug users, but evidence and experience strengthened our position. We only have to look back to the spread of HIV in Scotland in the 1980s and the way in which infections injecting drug users in Scotland were all but eliminated through needle exchange schemes. Injecting equipment provision can have a significant public health benefit. And as a result of this work and other prevention strategies, we have halved the annual number of new hepatitis C infections in Scotland from 1,500 in 2007 to 750 new infections in 2013. But there's more to do. Prevention is only part of the story. We knew that there were many people infected who had not been diagnosed. We prioritised testing in a range of settings. We made dried blood spot testing available, and we delivered general public awareness campaigns to inform the public. The result has been a significant increase in rates of testing, particularly in GP practices, addiction services and in prisons, and we've seen an increase in diagnosis. In 2007, only 39% of the estimated infected population in Scotland was diagnosed. In 2013, that figure has climbed to 55% and it continues to rise. We've also significantly increased our hepatitis C treatment capacity. We have more than doubled the number of people who commence treatment every year, from fewer than 500 a year to over 1,000 a year. This change alone is a significant achievement. It's no exaggeration to talk about 400 or 500 people now being treated every year who would not otherwise have been. And we can say with some confidence that the majority of these people, even with older therapies, will have been cured of their infection. All of this reflects tremendous progress over the last 10 years, and I want to just say a little bit more about the lessons that we have learned. But I also want to make the point that the job is not yet complete. When the Hepatitis C Action Plan came to an end in 2011, we produced our Sexual Health and Bloodborne Virus Framework, which very much maintained the same priorities and actions. And I'm pleased to say that today the Scottish Government is publishing an update to that framework to reflect recent developments. Our updated framework sets out a range of important actions and activities in relation to sexual health, HIV and viral hepatitis. Of course, it reflects a changing treatment landscape, perhaps the most significant development of recent times in relation to hepatitis C. The first of these new generation of therapies was approved for use in Scotland in late 2014. And since then, these therapies have been made available to patients. And these new therapies, without a doubt, mark a watershed moment in the treatment of hepatitis C, offering much more tolerable treatments which can achieve very high levels of viral clearance. Of course, the pricing of these drugs is an issue for all countries, including ours, and I'm sure this will be a subject of much debate over the next few days. I believe it's important to ensure that as many people as possible can be treated. And that's why I'm pleased to say that our updated framework commits us to increasing our annual treatment targets to at least 1,500 people per year, a near 25% increase on the number of people treated last year. We will review that figure annually, further increasing the treatment target whenever it's possible to do so. Through this commitment, we're aiming for a 75% reduction in the annual number of people developing hepatitis C-related liver failure or liver cancer in Scotland by 2020, and I believe that target is achievable. Prevention, though, remains a priority, and we'll continue to support injecting equipment provision. And we know that there are still people undiagnosed who would benefit from treatment, and we want to find them. And that's why we've committed to taking forward work to prioritise case finding of those who have been lost to the health service, and will investigate different approaches to screening populations for hepatitis C. Perhaps most importantly, I'm proud to say that the updated framework we're publishing today contains a commitment from the Scottish Government to the elimination of hepatitis C as a public health concern. I absolutely recognise that Scotland is in a good position to be able to make this sort of commitment. We have the support of a strong and well-resourced National Health Service, and we have clinical and public health expertise. We have a very engaged patient group, and we have political support. I know that these circumstances do not exist in all parts of the world, but I believe that there are some key transferable lessons from our experience that can be shared, and that's why we're here today. There are 2 or 3 specific lessons I just want to pass on from our experience, and I'll cover these briefly. Firstly, the importance of gathering robust data. Our action plan started with 2 years of data gathering that set the foundations for everything that followed. Understanding the problem will inform the best action to take. It's important to continue to gather data during the delivery of interventions to measure progress and demonstrate success. In Scotland, we would not be able to demonstrate that progress that we've made without the commitment to evidence and data, and the work of our experts in Health Protection Scotland and the NHS have been critical to that. Secondly, it's important to have a clear, structured plan setting out what will be delivered, by whom and by when. In Scotland, we have set clear goals, for example, the number of people to be treated each year, and this has been key to motivating not only the number of people on treatment, but also the number of people getting tested and diagnosed. I know this lesson is very much in line with the work of the World Health Organization that they're doing in their national strategies, which we'll hear more about today. The third lesson is about accountability. Scotland established strong accountability networks to not only support, but to challenge and drive performance. I and other ministers maintained a very close interest in this work, and we're able to hold delivery partners to account. And this has been key in achieving the goals that we have set. And finally, I'm a firm believer in the involvement of patients. I think this is one aspect where Scotland has been particularly recognised in terms of our response to hepatitis C. Our action plan was driven in the early days by patients. We've continued to work directly with patient groups, and we continued to do so, both in developing our updated framework, but also in our work with those infected through blood products. This is very much an ethos at the heart of Scotland's health service and is not unique to hepatitis. Patients should be at the centre of all we do and involved in the design of services and solutions. I have no doubt that this summit would not be taking place here in Glasgow had it not been for our relationships with patient groups in Scotland and across the UK. I very much encourage policymakers and ministerial colleagues to work with patient organisations in your own countries. It really can make a huge difference. In conclusion then, we've come a long way in our hepatitis C journey. And with new therapies and ongoing commitment to prevention and research, I hope we are nearing the end of that journey and the end of hepatitis C as a public health concern. I hope our experience is helpful to others, and I'm happy for experts in Scotland to share whatever knowledge and experience they have. My colleague, Maureen Watt, who's here with us, who is the Public Health Minister in Scotland, she'll be here with you until about midday, as will I. Unfortunately, due to parliamentary commitments, our Parliament started back this week. We have to head back there later today, but I've asked to be kept informed of your discussions through the next few days, and I'm very keen to follow up on any issues that arise. I hope you enjoy the rest of this summit. I very much hope as many of you as possible will have the opportunity to enjoy some of the many wonderful experiences that Scotland and Glasgow has to offer before you return home. But I hope you have a fruitful conference. Thank you very much. Thank you.